Riverside Medical Center stood as a pillar of healthcare excellence in the affluent suburbs of Millbrook, Connecticut. Its pristine corridors and state-of-the-art facilities attracted the region's most skilled professionals and wealthiest patients. But beneath its polished exterior, deep-rooted prejudices were about to be challenged when Maya Johnson, a highly qualified African-American nurse, joined their staff. Maya had graduated summa cum laude from Yale School of Nursing, her academic achievements speaking volumes about her dedication and skill. Despite her impressive credentials, she felt a familiar knot of anxiety in her stomach as she walked through the hospital's marble-lined entrance for her first day. The scent of antiseptic mingled with an underlying tension that seemed to permeate the air itself. The nursing supervisor, Patricia Wells, greeted Maya with a practiced smile that never quite reached her eyes. Her orientation was brisk and impersonal, filled with pointed reminders about the hospital's high standards and prestigious reputation. Maya noticed how conversations would pause when she entered a room, only to resume in hushed whispers once she passed by. Dr. Richard Morrison, the hospital's chief of internal medicine, made his disdain barely concealed during their first encounter. His steel-gray eyes assessed Maya with undisguised skepticism as he questioned her qualifications and experience. His condescending tone suggested he doubted her ability to meet Riverside's supposedly superior standards, despite her exemplary educational background. The first weeks proved challenging beyond Maya's expectations. She found herself consistently assigned the most difficult and demanding patients, while her white colleagues received straightforward cases. The workload disparity was glaring, yet every complaint or observation was met with dismissive explanations about standard procedures and patient assignment protocols. Maya's mother had prepared her for such challenges during late-night phone calls throughout nursing school. The wisdom passed down through generations of strong women echoed in Maya's mind as she faced each day's obstacles. Her family's legacy of perseverance became her anchor during the most difficult moments when isolation threatened to overwhelm her professional resolve. One particularly challenging day involved caring for Harold Peterson, a patient notorious for his racist outbursts and refusal to accept care from minority staff members. While other nurses found excuses to avoid his room, Maya was repeatedly assigned to his care. She endured his verbal abuse with unwavering professionalism, completing her duties with precision despite the constant stream of degrading comments. Dr. Morrison seemed to take perverse pleasure in these assignments, often appearing in the hallway after Maya's encounters with difficult patients. His feigned concern masked a clear intent to push her beyond her breaking point. Each interaction reinforced the toxic culture that pervaded Riverside, where discrimination was disguised as maintaining standards. The isolation extended beyond patient assignments to every aspect of Maya's work environment. Lunch breaks became solitary affairs as colleagues found reasons to exclude her from their conversations and gatherings. Professional discussions would halt when she approached, leaving her feeling like an unwelcome intruder in her own workplace. Maya's commute home on the city bus provided daily reminders of the economic disparities that her position highlighted. Dr. Morrison made a point of driving past the bus stop in his luxury sedan, his knowing smirk serving as another subtle reminder of the barriers she faced. These small cruelties accumulated like paper cuts, each one seemingly insignificant but collectively devastating. The situation reached a critical point when Maya was assigned to care for a VIP patient who had been admitted following a serious mountain biking accident. Robert Hamilton arrived with both arms severely broken, requiring extensive care and attention. The unusual level of preparation and nervous energy surrounding his admission suggested he was far more important than initially apparent. Unlike the other patients Maya had encountered, Mr. Hamilton treated her with genuine respect and interest. His questions about her background and experiences at Riverside seemed to probe deeper than casual conversation. There was an intensity to his observation that suggested he was assessing more than just her medical competence. Dr. Morrison's behavior around Mr. Hamilton was markedly different from his usual condescending demeanor toward Maya. His obsequious attention to their VIP patient contrasted sharply with his previous dismissive attitude, creating an obvious inconsistency that didn't go unnoticed. The doctor's transparent attempt to appear supportive of Maya's abilities rang hollow, given his previous treatment. During the days that followed, Maya found herself spending considerable time in Mr. Hamilton's room. His genuine curiosity about her experiences and the hospital's culture provided a welcome respite from the hostility she faced elsewhere. Their conversations gradually revealed the depth of discrimination she had been enduring, though she remained diplomatically vague about specific incidents. The mounting pressure of her impossible workload and constant scrutiny began taking its toll on Maya's physical and emotional well-being. Her colleagues watched with barely concealed anticipation, waiting for her to crack under the strain. The toxic environment had created a perverse spectacle where her struggle became entertainment for those who had never faced similar challenges. Maya's breaking point came during a high-stakes emergency surgery where she was unexpectedly called to assist. The operation carried enormous pressure due to the presence of hospital board members and other important observers. Dr. Morrison's nervousness was palpable as he prepared for a critical procedure, his usual confidence replaced by obvious anxiety. In a moment that would define her career, Maya recognized that Dr. Morrison was about to make a potentially fatal error. Despite the risk to her position, she spoke up to suggest an alternative approach. Her intervention likely saved the patient's life, but also exposed Dr. Morrison's fallibility in front of the hospital's most important stakeholders. The aftermath of the surgery brought Maya face to face with Dr. Morrison's barely contained rage. His mask of professionalism finally slipped as he confronted her in what he believed was a private setting. His tirade escalated from professional criticism to openly racist accusations, revealing the true nature of his animosity toward her presence at Riverside. What Dr. Morrison failed to realize was that their confrontation was taking place in Mr. Hamilton's room, where the patient had been quietly observing the toxic dynamics that had been plaguing Maya since her arrival. The VIP patient's unexpected intervention stopped Dr. Morrison's verbal assault and revealed the true extent of the discrimination Maya had been enduring. Mr. Hamilton's transformation from quiet observer to powerful authority figure shocked both Maya and Dr. Morrison. His commanding presence and obvious influence suggested connections far beyond those of a typical patient. The revelation of his true identity as Robert Hamilton, CEO of American Healthcare Systems, one of the nation's largest medical conglomerates, sent shockwaves through the room. The confrontation that followed exposed years of systemic discrimination and unprofessional behavior that had been allowed to fester at Riverside. Mr. Hamilton's witness testimony carried the weight of industry influence, making it impossible for the hospital administration to dismiss or minimize the severity of the situation. His demands for immediate change came with the implicit threat of severe financial consequences. Within hours of the confrontation, Riverside Medical Center was in crisis mode. News of the discrimination scandal spread rapidly, attracting media attention and forcing the hospital board into emergency sessions. Dr. Morrison found himself suspended pending a full investigation, while Maya suddenly became the center of institutional transformation efforts. Mr. Hamilton's influence extended far beyond a single hospital, and he made it clear that Riverside's response would determine the future of their relationship with American healthcare systems. His demands included comprehensive diversity training, policy overhauls, and the appointment of Maya to a newly created position as Chief Diversity and Inclusion Officer. The transformation of Riverside Medical Center became a model for healthcare institutions across the country. Maya's leadership in implementing systemic changes earned national recognition and speaking opportunities at major medical conferences. Her story became a powerful example of how individual courage combined with institutional pressure could create lasting change. 1 year after the confrontation that changed everything, Maya addressed a packed auditorium at the National Healthcare Equity Conference. Her presentation detailed Riverside's journey from a discriminatory institution to a model of inclusive excellence. The changes had improved not only staff morale, but also patient outcomes and institutional reputation. The ripple effects of Maya's experience extended throughout American healthcare system's network of facilities. Mr. Hamilton implemented similar diversity and inclusion programs across all affiliated hospitals, creating a new standard for healthcare equity. Maya's influence grew beyond Riverside as she consulted with other institutions seeking to address their own discriminatory practices. The hospital that had once seemed determined to push Maya out now celebrated her leadership and vision. Former colleagues who had participated in her exclusion became advocates for the cultural changes she had championed. The transformation proved that even deeply entrenched discrimination could be overcome with persistent effort and powerful allies. Maya's office now overlooked the hospital's main lobby, where a diverse group of medical professionals worked together in the collaborative environment she had helped create. A plaque on her wall read a quote that had become her personal motto: "Excellence is not about perfection, but about the courage to do what is right when it matters most." The story of Maya Johnson and Robert Hamilton became a case study in business schools and medical programs across the nation. Their partnership demonstrated how unexpected alliances could emerge from the most challenging circumstances, creating positive change that extended far beyond individual experiences. As Maya reflected on her journey from an isolated nurse to a national leader in healthcare equity, she understood that her struggle had been about more than personal survival. Her perseverance had opened doors for countless other healthcare professionals who would follow in her footsteps, ensuring that Riverside's transformation would have lasting impact. The legacy of that fateful day continued to influence healthcare policy and institutional culture years later. Maya's story served as proof that systemic change was possible when courage met opportunity, and that individual actions could indeed transform entire industries for the better.